Hello and welcome, students of IUMW. My name is Muhammad Amin. So previously, I had made an infographic poster on tic disorders. It's a part of my college assignment on the subject of psychology. So the main idea behind my poster was to spread awareness regarding what tics are to people who don't know what tics is. Due to the small size of the poster, I couldn't cover much more on tic disorders. So to do this topic justice, I'll be elaborating further in this presentation of mine. Let's have a quick look at what my poster covered. So, I defined what tics are. I listed out the types of tic disorders. I explained its symptoms. Here's some statistics that I pulled from CDC. And a little information regarding treatment of tic disorders. According to the DSM-5, or the 5th edition of the Diagnostic and Statistical Manual, tics are rapid and involuntary actions, which are movements or sounds caused by quick and recurrent muscle jolts. There are people who twitch involuntarily, and they may perform movements or noises that they can't control. While some actions may appear meaningful, please keep in mind that it was done without any intent or purpose. For example, individuals might feel the urge to repeatedly flail their arms, make a face, or in some rare cases even curse. Although these actions might be normal in some situations, the fact that they are repeated even in inappropriate situations is why they are considered abnormal. The DSM-5 lists 3 major types of tic disorders: Tourette Syndrome, which is most well known, persistent motor or vocal tic disorder, also known as chronic tic disorder, and provisional tic disorder. The following is a bit confusing, so try to keep up. We use the following 3 criteria to group individuals into one of the 3 types of tic disorders, all of which starts before the age of 18. Tourette's and chronic tic disorder lasts for a year or longer. However, provisional tic disorder lasts for less than a year. To be grouped into Tourette's, you need to have at least 2 motor tics and 1 or more vocal tics. For chronic, you need to have at least 1 or more motor tics or just 1 or more vocal tics. Lastly, provisional requires at least 1 or more motor tics or 1 or more vocal tics or both of them together. Tics can come in 2 forms. They can be simple or complex. Simple vocal tics are noises that are meaningless, as in they aren't words like clearing the throat, coughing, spitting, or even barking. These are just random noises. Complex, however, it's a little more complicated than that, hence why it's called complex. They appear more meaningful because this time they are words. It could be a word or a phrase that was said by somebody else. They could be repeating their own words, or they might say something inappropriate that is out of place. Motor tics also come in 2 forms. Simple motor tics are short in duration. They are actions like eye blinking, or shrugging the shoulders, head jerks, or darting the eyes. Complex motor tics last longer, and they are often accompanied by simple motor tics, like shaking the head and shrugging the shoulders at the same time, but for extended amount of time. Echopraxia is where you mimic the movement of others, and Echopraxia is performing inappropriate gestures, like touching someone's nose or giving them the finger. In the following clips that I'm about to show you are some of the examples of people living with Tourette's, one of which is an international pop icon, and that is Billie Eilish. Roll the video.
And so you spoke about something that I think is really important and brave that you didn't intend to speak about, but that you have Tourette syndrome and that it comes out at certain times. But I think that's amazing that you spoke about it, because you kind of take away the, scariness of it.
It's something I've lived with my whole life, and everybody knows, like everybody in my family, all my friends, all the people that are closest to me know I have it, and it's not anything different, And I just never said anything because I didn't want that to define who I was. I didn't want it to be like the artist with Tourette's, Billie Eilish is on Ellen.
Yeah.
I have ways of kind of making them go away. So if I'm on if it's like an on-camera interview or whatever, I'm sitting there answering the questions like, and then they start asking me questions and I'm like, and then everyone's like, that's so funny. And they made a whole, there was tons of compilations like, this is so funny that Billie did this facial expression, when really it's just a bunch of tics.
Bad, and I was at the park and there was no bath.
You take me back to the beginning just a little bit. You
think that it's like,
Well, but part of it is, and I assume then you don't really feel present. Some of the songs are very much from your own experience. And Billie, like, how much of yourself do you, and this is going to sound weird, but how much?
Words. When we had you in the other day, she recorded that whole interview too.
That was a funny interview.
It was.
She was funny.
Yeah.
Amazing, by the way. I'm sure special for any artist, but.
Okay, your turn. I knew you. I figured you didn't have one. So I figured. I mean, that's what I thought. I mean, that's what I figured. Okay. A yellow 5.
This is a 31-year-old gentleman from Canada who was first diagnosed with Tourette Syndrome at the age of 6 years of age. And we are going to film him this morning, showing the various physical and vocal tics that he has. What was the first tic you had when you were 6 years?
Oh, okay. Yeah, this is the thing that I find it difficult when I have a conversation. This tic comes out and then cuts the conversation. I feel sorry to the other person that I'm talking to. Anyway, it was like when I was 6 or 7 years old. According to my mom, I started walking a little funny, like a little one-side jumping and stuff like that. And even when I ride bicycle, like something like I would drive with one hand, not intentionally, but something like that. But first symptom that occurred was walking funny in one leg. And then it increased, or it got worse by doing my eyes, something like this, and I do this all the time. And in my age of 14, there was so much facial grimace and movement. I kept on have to move like this way so I can hear popping sound. But the popping sound, it need to be like in a way that would actually satisfy my urge. When I think some stuff, sometimes they are the thoughts that I want to think, and sometimes they are thoughts that I didn't even think that I would think of those stuff, and it just comes out as just like acting on what I'm thinking, which I didn't mean to, and of course some stuff that socially were not accepted. Fortunately, I didn't say a lot of bad words that occurred in many Tourette syndrome people, but I sometimes do, but I do in a way that other people can't recognize. So that's it, yeah. And it disturbs a little so much of my reading, studying. Well, yeah.
Do you have a university degree?
I do.
Which university?
It's in the Philippines, St. Mary's University.
Oh, very good.
Yeah.
Moving on. As for some additional information, individuals can tell when they're about to tic. They notice it just like an itch before reaching to scratch, or that feeling you get before you sneeze. Tics also tend to become more common or more severe during periods of anxiety, excitement, or exhaustion. What are the risk factors? Well, it's hereditary. You could genetically inherit it from someone within your family who've had a history with tics. It's only a matter of time before your symptoms start showing. But who knows? You might get lucky and not develop any tic disorders. But how could it happen in the first place? So, scientists hypothesize that it might be caused by an abnormal behavior in the brain. a part known as the basal ganglia. So from what I gathered, it's a part of your brain that is meant to suppress the urges of doing something you're thinking of doing, but you don't actually want to do it. And when this doesn't function properly, you tic. So I have a clip here that I'm about to show you. Roll it.
The neuroscience of Tourette syndrome is still poorly understood, but a number of studies suggest an important role for a group of structures known as the basal ganglia, which includes the caudate, putamen, globus pallidus, substantia nigra, and subthalamic nucleus. The basal ganglia are involved in diverse brain functions, but they are especially relevant to Tourette syndrome for their hypothesized role in suppressing unwanted actions. According to this perspective, one function of basal ganglia circuitry is to inhibit neurons in the thalamus and prevent them from sending undesired movement-related signals to the motor cortex. In Tourette syndrome, it's thought that faulty inhibitory mechanisms in the basal ganglia may fail to stop unwanted signals from reaching the cortex. This causes the execution of an action that the patient might prefer to suppress, forming the basis for tics. The failed inhibition in the basal ganglia is thought to be coupled with increased activity in motor pathways that generate movements. Thus, patients with Tourette's might experience a problematic combination of high motor activity that generates habitual patterns of behavior, along with abnormally low inhibitory activity that would normally keep those behaviors from being acted out. More research needs to be done, however, to fully elucidate the neural circuitry underlying the disorder.
A tic disorder is developed during complex interaction between genetics. It could also be caused by some environmental factors, but the truth is, we don't know for sure. The research is still ongoing. A quick disclaimer, the following data was conducted by the National Survey of Children's Health in the US, based on 51,001 US children aged 6 to 17 years throughout the year 2016. Here's some of the data I plucked. We can see that a person with Tourette's is more likely to have another condition compared to those who don't. Among these people, 61% had anxiety problems, 52% had ADHD, 34% had a learning disability, 21% had autism, and only 8% had intellectual disabilities. Apparently, boys are 3 times more likely to have Tourette syndrome than girls. Also, 1 out of every 100 children has a tic disorder. Now, there's a lot more data, but if I were to show and talk through all of it, we will be here for a while. So let's just skip it for now. I have the links in my references, so you can have a read after. There is no cure for Tourette's or other tic disorders, but tics can be managed through a combination of therapy and medications. Cognitive behavioral therapy, or CBIT, can help individuals identify triggering events or feelings that precede tics. And habit reversal training can help someone learn to do movements that are incompatible with the tics, like engaging opposing muscle groups, which will be like smiling if the tic is a frown. There are also a number of medications that can be used to control tics, but these are only used in the most severe cases. For example, antipsychotic medications such as Haldol and risperidone, and some epilepsy medications can be effective, although they often cause unwanted side effects. ADHD medications like Adderall can also help some individuals focus on and therefore control their tics. Deep brain stimulation is best kept as a last resort, as it is an invasive neurosurgical procedure, which is actually intended for treating Parkinson's disease. It's for those severe cases that don't respond well for conventional treatment I've described earlier. Here is a clip of how the surgery is done and what it does.
This is how the deep brain stimulation will work. 2 electrodes will be placed deep in Bianca's brain where faulty neurons cause the Tourette's. The probes are connected to a battery which will be put in Bianca's side. The electrodes basically reset the misbehaving brain cells, And if it all goes to plan, most of the tics should disappear.
There's a part of the brain that is not in harmony, and so we have to get down to that area and reharmonise it, and we do that by outpulsing it with electricity.
From what we gathered, I think it's clear as to why this method is considered controversial. In conclusion, I hope that by spreading awareness, people understand individuals with tics better, not give them weird looks, not bully them, and among other things, so they can live with less stress and anxiety when interacting with people outside the public. It is a challenge they have to live with, therefore let's not make it harder on them. Thank you.